Okay, so a little chat on the kind of medical provider you choose, assuming you have some choices, hopefully, um, to address different specific needs, medical needs. While I'm talking about this, I'm going to be talking about it from a perspective of the legal evidence and the kind of weight it is often given by the SSA, and not from a medical perspective, because I'm not a doctor or a medical professional. Okay. So, but the reason I bring it up is because a particular case today, was speaking to the adjudicator, super, super nice person. And the person in this case is under 50 by quite a few years. And as you probably know from many other videos out there, including my own, there are, it's a higher mountain to climb when you're under 50. It's still a huge mountain when you're over 50, but when you're under 50, certain over 50 rules do not apply, which makes it more difficult to climb that mountain. So in this case, particularly, how do I explain this? All right, so if you have, let's say, anxiety, you are not disabled from all jobs because of severe anxiety. You have anxiety. Does it affect you? Of course, or you wouldn't be getting treatment for it. But it's not something that is in and of itself, all by itself, disabling. In fact, it's on top of other things, maybe some very severe physical disease or condition that has just altered the life tremendously, and certainly taken away the ability to work at any job on a reliable basis, 5 days a week, week after week after week, full time. Okay, so in this particular situation, this person who is going to specialists all over the place for some really severe and more unusual conditions that seem to be very much overlapping. But that's the physical, and then the mental happens to have a therapist and receives therapy to help cope with anxiety. And the therapist, of course, can't prescribe, because it's not like a nurse practitioner who can now prescribe if they are psychiatric, or an MD or a DO, or a psychiatrist. So she gets her anti-anxiety medication from primary care. This is not unusual in the real world. Psychiatrists are often very pricey, and there are not that many around. So sometimes it works better to get your talk therapy and then just get your medicines through PCP for practical purposes. I totally get it. However, for legal purposes, in terms of proving a case, without it being a psychiatrist or an MD or a DO, the diagnosis can't be made generally by a counselor. They can treat for it, and then everything they see, all those mental status exams and the affect and the mood and the presentation by the person at each session, that is what's very useful from them, but they can't necessarily initiate the diagnosis. So if all you have is a therapist and nobody else that diagnose, like a mental health professional with a diagnosing an acceptable medical source according to SSA law, that's going to be a problem. So by and large, I'm always suggesting people use specialists for all of their problems, including mental health. So while the PCP, and I do get it, it's very common that the primary care, might prescribe that, so the person doesn't have to bother going to a psychiatrist because they have a therapist and they're doing reasonably well. For legal evidence reasons, you're going to want to get a psychiatrist. And if you have, by the way, if your mental symptoms are such that they really are eliminating the possibility of jobs, like in most cases, they're not eliminating all jobs. They're just going to prevent maybe some of the ones that you need a lot of concentration for, maybe higher skilled jobs. And that's how we can knock those out of the park sometimes. But if it were to be something that you're saying, I can't work because, let's say I'm agoraphobic, I can't leave the house, severe form of PTSD or anxiety, you would definitely want that to be, any prescriptions to be by a psychiatrist, and the diagnoses to be it can technically be an MD, but my understanding is that the SSA is going to be less, potentially less likely to give strong weight to the opinion if it's not a mental health doctor, like a psychiatrist or a PhD psychologist. But of course, if they can't prescribe, then you're going to have to get the prescription elsewhere. And that might be then from your PCP, but you do have the psychologist, which is an acceptable medical source. So just driving home the point, and only because it came up today and the adjudicator flat out told me that was her concern. This is a difficult case because it's a younger person, and she's trying to do the best job she can. So she wanted to know if there was a psychiatrist, a doctor of mental health that was involved, and it wasn't. So what's going to happen is she's going to have an examination by a consultative examining psychologist, probably. Sometimes it's a psychiatrist, and they will confirm the diagnoses through that one hit, I suppose. But I did communicate with her about, and I hate putting more on someone's plate when they're already treating so much for so many really, really important things. So again, it's only about the legal evidence side. Not trying to put any more visits on someone's plate, because I know sometimes you're just going all the time, like, 2-3 days a week seeing doctors, and adding this is not making it easier. I will say one thing, they will often do video sessions. So that can be good if you are going to pick up even a therapist, but if you're picking up a psychiatrist, they might be able to do it by video. So you don't have to go out, use gas. If you have physical problems, that can be really difficult getting around, adding one more appointment to your day. So something to think about. But as a general rule, specialists, if it's a mental health thing, psychiatrist, not the primary care for that. Although the primary care should be well informed by you of all your mental problems and symptoms going on, because they're hopefully looking at the whole person. But because of this, we will have that consultative exam. We have other videos on the consultative examinations, and sometimes they're okay. Sometimes they're just not so okay. But you got to go when you have one. So she is going to have one because she does not have a diagnosis from a mental health provider. And interestingly, her PCP does prescribe anxiety medication, but the adjudicator thinks it would be better evidence if it were prescribed or diagnosed, not so much the prescription, but diagnosed by a mental health professional and not a family doctor. So just laying it out there. If you are, and there's some vocational reasons why this might be, this might actually help potentially get her on a listing, since she's under 50 and it's very hard to get her on RFC. Just a thought. Okay. Specialist. All right.